Welcome. BiPAP, bilevel versus CPAP. Understanding why CPAP is not for neuromuscular disease. First off, a disclaimer. This content is based on patient perspective and reading medical literature. Don't use this content as a substitute for medical care. Seek medical care for breathing or respiratory muscle weakness from a licensed clinician who specializes in the breathing issues of those living with neuromuscular disease. CPAP stands for continuous positive airway pressure. A CPAP has one pressure. That same pressure blows when you both inhale and exhale. Contrast that with BiPAP or bilevel device, which is sometimes referred to, that has two different positive airway pressures. A higher pressure for inhaling, known as IPAP, and a second, much more reduced pressure for exhaling against, known as EPAP. The difference between the two pressure numbers is called span. Bilevel or BiPAP assists with ventilation, the process of moving air into and out of the lungs. That process can be difficult for those of us with neuromuscular disease as our muscles between the ribs and diaphragm weaken over time. The diaphragm itself is what's responsible for assisting our breathing when we are lying down for sleep. A quote from the MDA Quest magazine article, Not Enough Z's, says, for the general population, continuous positive airway pressure, or CPAP, is the ventilation therapy commonly prescribed for obstructive apneas. CPAP blows in a continuous flow of air at a set pressure, keeping the airway from collapsing and obstructing breathing. But for people whose problem is caused by weak respiratory muscles, bilevel positive airway pressure ventilation, typically called BiPAP, is more commonly used. So why is CPAP a problem? Well, exhaling against a single pressure with CPAP that's strong enough to fill our lungs with air can be uncomfortable and difficult because of the weakened breathing muscles. That's why the lowered EPAP of a bilevel device, or BiPAP, makes it more comfortable for us. When the IPAP and EPAP of a bilevel device are at an appropriate level, breathing muscle rest can be achieved overnight. If you have weakened breathing muscles, CPAP can be exhausting, preventing breathing muscle rest. Another quote from the MDA Quest magazine article, Not Enough Z's, says all symptomatic, weak patients need full nocturnal inspiratory muscle rest with very high span BiPAP or use of portable ventilators to fully rest muscles, not CPAP, oxygen, or low span BiPAP, Bach says. Treat the patient, not the polysomnogram. Dr. John R. Bach is a pioneer in the field of non-invasive ventilation. Some frequently asked questions that we get. The first one, if I had a sleep study, so why did they prescribe a CPAP instead of BiPAP? Well, this is a common error when the physician is not familiar with breathing or respiratory muscle weakness in NMD. Keep in mind too that most sleep studies, they're designed to find apneas instead of measuring effort to breathe, which is what we have a problem with. Too often the equipment can interpret our weak effort for breathing, which is shallow, as apnea events or stopping breathing. Another quote from that MDA Quest magazine article, Not Enough Z's, says Bach questions the usefulness of polysomnograms for people with muscle diseases because the test interprets all abnormalities as central or obstructive apneas rather than muscle weakness, he says, especially when read by physicians unfamiliar with neuromuscular disease. Now, this may lead to another question in your mind. Well, if sleep study can be problematic and lead to diagnosis and ordering of a CPAP, then what do I do to get appropriate equipment for sleep breathing? Well, many of us have found that all that is necessary is spirometry or pulmonary function testing. And the results from that, combined with our diagnosis of a neuromuscular disease, generally is enough for insurance in the United States to cover a bi-level device. Now, some policies do require a sleep study, so it's important that you check with your provider to see what is necessary. A second frequently asked question: will an overnight oximetry study tell me if I need a BiPAP? An overnight oximetry study is just a condensed version of a sleep study that generally just measures your oxygen saturation. It's a recording pulse oximeter. So it's really hard to say because these usually only measure that oxygen saturation level during your sleep. One of the most important measurements for someone with a neuromuscular disease is exhaled carbon dioxide, the waste product of the air we breathe that gradually builds up in someone with weakened breathing muscles. It's really important to know what that carbon dioxide or CO2 level is when we're sleeping. A capnograph is a device that can measure in-tidal CO2, exhaled carbon dioxide, and a transcutaneous CO2 monitor is also an alternative to this that can measure CO2 through the skin. This is important for you to ask about when your overnight oximetry is scheduled. Some of us end up having these anyway, and that may be the only thing necessary to order a BiPAP or bi-level device. It really just varies. It depends on the level of expertise that the physician has and really what your insurance company requires for coverage of that equipment. A third and final frequently asked question on this topic is, how do I know if my current sleep machine is a CPAP? Well, what you can do is you can put your mask on, turn the device on, and notice whether or not you feel one continuous pressure or a reduced second pressure when you exhale. If there's just one continuous pressure of air, then you're using a CPAP. If you feel two, then you have a bi-level device or BiPAP. You can also ask your respiratory equipment provider what they have delivered to you. So I highly encourage you to learn more about breathing muscle weakness or respiratory weakness in neuromuscular disease. You can do so from our organization, Breathe with MD Inc. We're a 501c3 nonprofit public charity, and you can find us on the web at breathewithmd.org. Of course, we have a public Facebook page called Breathe with MD. You can also join our Facebook support group, which is a private group, meaning that only those members can see the posts and read the posts. This group is strictly for those who are living with the neuromuscular disease or their loved ones. We also have a presence on other social media platforms such as Twitter and Instagram, and we have a YouTube channel called Breathe with MD Inc. You're also encouraged to email us at info@breathewithmd.org. Just know that we're staffed entirely with volunteers and we're peer-led, so we don't have any clinicians on staff, and we do this as a very part-time endeavor. So if you email us, you're probably not going to get a response within a matter of minutes. It's probably going to be more like later that same day. But again, I just encourage you to learn as much as you can about this topic, breathing muscle weakness and neuromuscular disease, because we like to say knowledge is power. Thank you.